Today I'm getting Botox for TMJ. This is going to be my before. This is my before face. I'm definitely not getting this for aesthetics. I'm getting this done because I've tried everything under the sun for my TMJ. Nothing has worked. I've done the whole acupuncture. I've done trigger point injections. I've done mouth guard. I got Invisalign recently and it's still there. After my whole breast implant debacle, it's a long story. I got breast implants in when I was very young, and my body did not react well to them, and I got very, very sick. So after that, I told myself like I would never get anything implanted in me or have any type of like cosmetic procedure that was a foreign substance. Like, I'll never do fillers, but I'm going to try the Botox. I'm scared because the Botox supposedly supposed to be safe, but it's a neurotoxin. So, but just too many people have told me about it. Like, my own dentist was telling me like, you should try Botox. I've had to have a crown on my upper tooth in the back. I grind so much at night that I basically am cracking all my molars, and I'm wearing down my TMJ joint. So I need to do something about it. And so I'm going to take this risk, and I hope that I don't regret it. I guess my biggest fear is that I get botulism, which is probably the worst thing that would happen. Like, I just don't want it to like go systemic or something, and then I can't like breathe and I die. But I'm going to hope for the best. Like I said, I'm not doing this for aesthetic. I'm doing this because there's just so much tension here in my jaw, and I'm hoping it can help with that. I have noticed that my jaw has started to square off more. I don't know if it's because I grind so much that I have this jawline, but it's starting to like bulge out more. Part of this is that this should slim my face down a little bit here. But like I said, that's not the reason I'm doing it. So even if my face doesn't slim, I don't really care. I can record inside. I get really shy in person, like around people, and to like record, I get really like self-aware and self-conscious. But I'm gonna do my best to try to record the procedure. I'll ask if I can record, but. So I just saw the physician assistant. Her last name is Kennedy. She was very sweet, answered my questions, very nice. She says that in all the years that she's been doing this, that she's never had a complication. So, you know, hopefully I'm not that first one. You can see kind of like the injection here and here. And I believe I got 15 units of Botox. They said that she only injects Botox in the masseter and not any other kind. So yeah, we'll see. I will do a follow-up video. I don't feel anything right now. I put a topical numbing solution, so I don't feel anything right now. And then I can't look down for 4 hours, she said, or lay down for. I'm gonna do my best for that. I'm having like a bad asthma flare-up today, so yeah. So I can't lay down for 4 hours, and I'm gonna do my best to try to not look down for 4 hours. No vigorous exercise for, she said like 1 to 3 days, but I wanted to work out Sunday, so I asked if that would be okay. She said yeah. So yeah, we'll see. So I'm driving home and stopped. There's so much traffic. I would say that it stings a little. The solution stings. And then I don't know if she hit like, there's going to be some bruising, so I don't know if she hit a blood vessel or what. So I just got home. This side is very sore. Yeah, it just feels very sore. This side, even though it looks worse, I'm not feeling it at all. I feel like my range of motion has improved. So before, my range of motion on this side was limited just because there was so much tension. So I do feel like I can turn my neck more. This will bruise. I mean, I don't really care. I just want to feel better, and I don't want the complications that, you know, I want to make sure that I don't get any adverse effects and mess my body up even more than it already is. I just wanted to do a quick update. Today is day 2 after getting Botox. As you can see, my face still looks the same. I feel like my masseter is slightly more relaxed. I clench at night. That's why I have the TMJ disorder. So I can't control it. So last night I still felt like I was clenching, maybe not as strong as I did before. Side effects that I've felt so far from Botox is I've had a slight headache. I didn't really get super fatigued. Yesterday I was slightly fatigued, but I've just had like this light headache yesterday and today. Haven't even taken ibuprofen for it. The other thing that I noticed yesterday right after the injection was I felt a little bit dizzy. My masseter on this side is the problem. And that's why I got the TMJ. I don't feel the tension so much on this side. I do have some slight bruising here. Very minimal that like you can't even really tell. No, it's hard to record on this side, but no bruising on this side. I do feel slightly less pain today, but it's only day 2 and it takes a little bit longer to kick in than just on the second day. So I'm being patient. And obviously in such a short amount of time, there's not going to be any changes to my face. And obviously with such a short amount of time, there's no changes to my face. The only other thing that I wanted to say is that my jaw is sore, like bilaterally, both sides. It does feel sore, like a muscle ache, kind of like when you work out and your muscle is fatigued or tired, kind of like, I think it's more sore. Like, it's hard to explain. It's different. It's a different pain than what I used to have. It feels like it's been injured. Kind of like if you were to hit yourself and you had a bruise. That's kind of like what it feels like. Like the muscle just feels very sore bilaterally.